I'm Matt Willis, Public Health Officer with a status update for March 3rd. Today, the California Department of Public Health announced that most remaining state-based COVID orders will sunset within a month. I'd like to explain what these latest changes in policy mean for us in Marin. For some, these changes will feel long overdue, and for others, they may feel premature. I, by and large, agree with these changes, and whatever your view is, it's important to understand what's coming. The main changes in today's state announcement are in three areas: isolation, masking, and vaccinations. Remember, as I go through this list, that I'm describing California state regulations, which Marin County Public Health will follow, but that institutions and employers may have their own policies. First, effective March 13th, isolation requirements will change. Under the new state guidance, if you're infected, you can leave isolation after 5 days if you're fever-free for at least 24 hours and symptoms are improving. So you don't need a negative test after 5 days to leave isolation. This more liberal approach to coming out of isolation will make it even more important for people in that interval between day 5 and day 10 after a positive test to cover their face in indoor public settings or around vulnerable family members and friends. And remember, Cal-OSHA, which regulates workplace safety, will still require recently infected employees to wear a mask at work for a full 10 days. Second, effective April 3rd, the state will no longer require masks be worn in any setting, aside from employees recently infected, as I just mentioned. Remember, currently, masks are required in certain high-risk settings like hospitals. I've been in contact with our hospitals today, and they're reviewing their options and may continue to require masking in certain sensitive patient care areas after that April 3rd change in state law. Marin County Public Health will continue to support our healthcare institutions and their decisions to require masking in an effort to protect staff and residents if they choose. Also, effective April 3rd, vaccine requirements will be removed. Like masking, vaccines have been required by the state for employees in certain high-risk occupations, like healthcare workers. But starting April 3rd, any vaccine requirements would be at the purely institutional level. This must have been one of the most hardest calls to make, though I understand the rationale. We know that the vaccine now does a much better job at preventing severe illness than it does at preventing infection, because the new variants are better at evading the antibodies produced through vaccine. Still, the vaccine has really been our greatest tool in keeping our community protected in Marin against this virus. And our status as a county with some of the lowest death and hospitalization rates is really directly tied to our high vaccination rates. We also recognize that over 90% of our community has been fully vaccinated without any mandates, and will continue to rely on healthy decision-making and institutional policies to support vaccinations. One state law that will remain is that hospitals will still be required to report COVID hospitalizations. Remember, in Marin, we're using wastewater levels to monitor community transmission rates and hospitalization rates to maintain visibility on the most severe cases and the burden on the hospital system. And we'll continue to report to you, our community, on what's happening in our hospitals on our website. Stepping back, these changes, along with the end of the state of emergency for California and Marin that happened 3 days ago, indicate that the COVID-specific regulations we've been operating under for 3 years are becoming a thing of the past. We're moving from the extraordinary measures that were once necessary to more ordinary measures to control this virus. We're entering a new chapter, and it's likely one of the last chapters in our pandemic story, because we have the tools we need to manage. Testing, effective vaccines, effective treatments, mask use for people in settings at higher risk, and effective monitoring systems to guide our ongoing response. And as always, our most important tool is one another, and the knowledge that we all do better when we act together using the best available science. Thank you for doing your part.